Orthodontic treatment in patients with cleft lip and palate represents a clinical challenge that requires an individualized and multidisciplinary approach. These congenital malformations involve alterations in bone, dental, and functional development, affecting facial aesthetics, phonation, swallowing, and occlusion. Orthodontic intervention is planned in stages and must be coordinated with surgical, speech therapy, and prosthetic procedures. In the presurgical phase, orthopedics is used to stimulate maxillary growth and promote the approximation of bone segments before chyloplasty or palatoplasty. Subsequently, during mixed dentition, interceptive orthodontics helps correct malocclusions such as crossbite or arch collapse. In adolescence, fixed appliances are used to align teeth, prepare the alveolar bed for secondary bone grafts, and improve the intermaxillary relationship. Precise planning is essential, as cleft patients present particularities such as dental agenesis, ectopic eruption, post-surgical scarring, or skeletal discrepancies. In addition, close monitoring of oral hygiene and prevention of periodontal disease are required. Integrating orthodontics within the cleft care team is key to achieving satisfactory functional, aesthetic, and psychological outcomes. Well-coordinated treatment improves the patient's quality of life and facilitates social reintegration.